So, ladies and gentlemen, the first item on the agenda is the inauguration session. Dr. Kamini Rao is unable to be with us this morning, but we will hear from Mr. Nandakumar Jairam, who is the CEO, Chairman and Group Medical Director for Columbia Asia Hospitals here in India. Dr. Nandakumar Jairam is trained in minimally invasive surgery and is well known all over the world for authoring several papers in the prestigious British Journal of Surgery. In fact, I caught up with Dr. Jairam a short while earlier and I asked him, what is it that you're going to speak to the audience today? And he told me that today he's going to address us about the wheel of healthcare. What is the wheel of healthcare? Even I don't know, because that's a mystery that only Mr. Jairam is going to share with us today. So, Mr. Nandakumar Jairam, the stage is all yours. We all want to know what is the wheel of healthcare, and you're all ears from this point onwards.
Thank you very much for that introduction, and for calling me between Mr. and Doctor. He left everybody a bit confused. I'm basically a surgeon, so surgeon by British terminology could still be a Mr. So, no offense. Thank you and good morning, ladies and gentlemen. It's a privilege to be here, and it's a privilege for several reasons. Firstly, because everything started on time and bang on time, and this is the way any event should go anywhere in the world, so thank you for that. Secondly, because this is an event which is indeed unique. It has every possible person from healthcare involved and present here. So, I am indeed pleased to be here and to speak to you for the next few minutes. When I was asked to speak, I wondered, what do I say? I can't talk about medical furniture. I can certainly talk about surgery, but that's not what is really important. And therefore, I kind of rummaged through and landed myself on this wheel. And it told me a lot. It told me about where we are and what we should be. And I thought it is best that I share my own perspectives with you this morning using not the wheel of fortune, but the wheel of healthcare. Ladies and gentlemen, I believe, and I'm quite sure that I am correct in this statement, there's nobody in this hall who has seen healthcare for longer than myself. It's more than 4 decades that I have been in healthcare, and I have started with a simple stethoscope, and I have laid down my scalpel on the 31st of March this year, understanding that this was not the medicine I learned. And if you look back at the change in healthcare over the last 4 decades, it changed constantly. But never before has the change been so fast, so stupendous, and so earth-shattering as it has been in the last decade, and specifically in the last 5 years. If you can place your hand or finger on why these 5 years have been so critical in the changes in healthcare, you understand clearly that it is advancing technology, number one, which enables you to deliver medicine and healthcare to the people at a much more accurate rate and ensure that you have better outcomes than ever before. And the second is data. And the data that you now collect not only enables you to analyze and produce methodologies and ways of treating or preventing illness, but the same data, and huge chunks of it, can go into the creation of artificial intelligence, which is the way forward from what we are today. And therefore, it is indeed very exciting times for healthcare. And these exciting times also require us not to run without pondering and understanding whether what we are doing is correct and the way we are doing it is equally appropriate. I draw your attention now to this wheel. It doesn't look too much like a wheel on the screen, but it is a wheel which are circles within circles and all of you understand from your geometry that every number of circles has a single center point if they are concentric. And look at what is in the center. What is in the center is really what we are all there for, and that is patient-centric and value-driven. I would like you to pause on the word patient and actually consider changing that to person-centric, and I'll very shortly describe why. And value is clearly something that we all require in any aspect of what we do. I next draw your attention to the top end of the circle. Healthcare population. Population needs in healthcare is changing. How is it changing? It's changing in different ways. Obviously, all of us are aware of the NCDs and the disastrous effect it has on the cost, the morbidity of human race. But I draw your attention to such issues and problems that are created by mankind. And to name a few, I would say road traffic accidents, the ill effects of nicotine, and these two examples are sufficient for you to understand that whereas the changing healthcare needs of the population is a fact, some of this is within the control of mankind himself, and changing this landscape and enabling us to be more healthy and not to suffer where we need not is perhaps one of the most important lessons that we need to carry today as we provide healthcare to our nation. But that is not all. You will all understand that the expectations of our customers is also changing rapidly. And that is the next segment that you see on the outer circle. This heightened expectations has many tangential effects in the way healthcare is delivered. And these changes can indeed be substantial and very, very important. Defensive medicine, as it is practiced in the United States, or the fact that people are much more worried about litigation and decide how and what they should do or avoid doing is indeed disastrous for any race. This, of course, seems to be a fact of life and is ever present not only in our country but everywhere else. Now let's look at coming down and understand how and what we do in terms of delivering care. Gone is the day when the physician was the center of any healthcare provision. Today, it is integrated. It is integrated with a workforce which is extremely dependent on each other and is ever changing. The roles of the physician, the nurse, is changing rapidly. Integration between various types and forms of medicine is happening irrespective of whether one wants it or otherwise. These changes are also extremely important. Are they necessary? The answer is yes, because the landscape in which we are today is indeed different. And therefore, we are coming up with newer models of healthcare delivery. You may be surprised to know, or perhaps you already do, that over the next 10-15 years, you would find that the number of inpatient hospital beds which are non-critical would gradually reduce. And we would find hospitals that are primarily for critical care and nothing else. Obviously for surgical and deliveries and so on. But just the ward where a patient lies down to recuperate or remains in hospital is likely to be a thing of the past. Look at how all this has added to the cost of healthcare. It is inevitable, therefore, that the cost of healthcare rises, and in turn, it produces a strain on the finances that healthcare requires, not only for its delivery, but also to create healthcare for a population. Let us pause here and understand what the rest of the world has done. All of us are familiar with the several systems of healthcare across the globe. The United Kingdom was considered to be one of the forerunners in the social form of medicine delivery and created the NHS, which was considered to be hugely successful for many decades. But then the financial strain showed up. The strain of an inadequate workforce showed up. And today, that very system is crumbling. Look at the United States. The less said about how efficient that healthcare is, the better. I'm not saying that the physician or the manner in which medicine is practiced there is not good. It is in fact excellent and perhaps one of the best in the world. But the affordability, in spite of the United States being as rich it is something that is exerting a strain on that population and the government. So you can imagine that two of the nations which are most developed or considered most developed have health systems that are inadequate to meet the needs of their country. Let's come to India. In India, this landscape is evolving. As I stand here and speak, the way in which healthcare was practiced is changing. The economy has changed. We are a nation which is vibrant and forward-moving, and at this point, we're really defining for ourselves how healthcare is to be delivered. All of us are aware that 70 to 80% of the healthcare of this nation is provided by private healthcare players. And the way in which we now join together, and I use that word join together, and enable the health of this nation to be what it should be, will define not just the healthcare industry, but the future of this nation. With increasing NCDs, with the strain on the healthcare system, with an inadequate workforce that delivers healthcare, we have a problem. Is the problem being addressed? The problem is being addressed, but not in a coordinated fashion. The government has its own agenda. The private healthcare player has his own agenda. And unless these two look at each other, work cohesively and together, we are not going to see the circle that we need to do to create that efficiency. Now let's come into the inner part of this circle, and I draw your attention to the lower marked in red. Digital connectivity is the world today, and we in healthcare are being digitally connected. And let me ask you, who is governing this digital connectivity? The answer is inadequately and in fact nobody. I therefore say that while technology and digital aspects of any part needs to move faster and surely at a greater pace, there needs to be an understanding that governance at this stage is indeed important. And of course, look at the workforce. India's surgeons and physicians are lauded globally. Their abilities are no better than anybody else. We have the MBAs from the institutes who are again world class. But look at healthcare leaders. We have just started seedling in this category of people, and the country needs them urgently. The country needs more qualified doctors urgently. The country needs well-trained doctors and well-trained nurses, because if we produce large numbers without quality, the ultimate answer is disaster. Ladies and gentlemen, in this, therefore, there is a need for us to broaden and deepen the clinical abilities of this nation as well, if we are to maintain the standards that we would have to have for our nation. It is important that this is indeed done. I would get lost and continue to speak, but I know that I have a time limit, and I, as I said, would be extremely conscious of holding on. Let me therefore quickly summarize some of my thoughts. We are at an inflection point in healthcare in India. There are changes in the manner we have practiced and are practicing and will practicing delivery of healthcare. There is a lot that needs to be done. And this cannot be done just by the private sector or by the government. A cohesive action towards the delivery health and the prevention of disease is extremely important for our country. We need to have a better workforce, a more committed workforce, and committed in the sense of enhancing their quality of delivery. And above all, ladies and gentlemen, we need governance. Not the kind of governance that the government would do or give, because that again is a disaster. And without mentioning institutions in our own country related to medical education and health, let me say that this governance has to come from within the system. Being an Indian and a proud Indian, I am confident that this will happen. I am sure that through the democratic process and the noise and the thumping of desks that is so much part of the Indian ethos, we will reach there. And I wish to see that day when we are proudly the best healthcare that the globe has. Thank you for listening to me.